Dr. Sharkey, thanks for joining us.
Sure.
Our segment title this time is Allergy Testing. What are you allergic to? Seems like we're all allergic to something, particularly in this part of the world. What happens physically to somebody when someone is allergic to something?
Well, when you're allergic to something, that means you've got an allergic antibody in your body specific to whatever protein it is. So say you're allergic to cat. When you go to someone's house with cats, you're exposed to cats, you breathe in that protein, it binds at that allergy antibody, and that causes your allergy cells to release chemicals that cause the allergic reaction. So depending on where the allergy cells are that release the chemicals, that's going to determine what kind of reaction you have.
And what typical reactions? Where do you see allergies?
So if you're having just hay fever type allergies in your eyes, you can get itchy, watery, puffy red eyes. In your nose, you can get a lot of itching or sneezing or sniffling. A lot of people get stuffed up, and that can lead to ear and sinus infections. People's ears can get itchy. You can get a lot of drainage in your throat or cough. If it's in your lungs, you can get asthma symptoms with coughing, wheezing, shortness of breath, tightness. If it's in your GI tract, you can get cramping, vomiting, or diarrhea. If it's in your skin, you can get eczema or hives.
Okay. How do you make the determination that someone needs allergy testing?
History is the key. So when you have someone who either has a history that suggests allergic symptoms, like some of the symptoms I just mentioned, or you have someone who has an allergic disease process, like rhinitis symptoms or a lot of sinus disease, or if they've got asthma or bad skin, then that's going to lead us to think, okay, there's a good chance this person has allergic triggers. Allergies are more common in young people, children and adults and young adults, or at least they present more commonly in young people, but they can be present at any age. We've had people more than 90 years old come into our office and find allergies. But like I said, it's got to be matching the history to what you find. So if you have someone with allergy symptoms and a history that getting around those certain triggers gives them those symptoms, then that's somebody we want to test.
What types of allergies do you typically test for?
We test for inhalant allergies, so year-round allergies like dust or mold or cockroach or animal dander. We test for food. We test for seasonal allergies. So if you live in East Texas and you're bad in the spring, we think about trees and grass. And if you're bad about the time school starts, we think about grass and ragweed. So we're going to test seasonally based on what you tell us. We test foods. So if there's a history that you eat a food and you get some adverse symptoms, then that might lead us down to testing foods. If you have eczema, especially young kids with eczema, young children with eczema below the age of 4, when their eczema is moderate to severe, they have a high incidence of food allergy underlying that. So we actually do testing in foods in those children. If you had a history that a bad bee sting or a wasp sting or a fire ant bite made you swell up or break out or have allergic symptoms, that would certainly, you would want to get tested for that. Finally, we have some people with medication allergies or allergies to certain occupational exposures, like say you're a nurse that works in the ICU and every time you put on a latex glove or get around somebody gloving you get symptoms. Those are all things we can test.
Okay. How do you do a skin test for allergies?
Well, again, so we've identified the patient that we want to test based on our history. What we do is we put on 2 controls. We put on one chemical salt water that no one should react to and one chemical histamine that everyone should react to. And as long as you show a good positive where you'll react and a good negative where you don't react, that tells us that if you're allergic, it'll show, and if you're not, then it won't. And then based on what we've gleaned in the history, then we're going to test either inhalants or foods or whatever the history suggests. The way we test that is we usually test on the back. And so it's important not to have a rash on the back. It's important not to have used a lot of steroid cream on the back. And it's important that you cannot be on antihistamines or certain other medications that may interfere with the testing results. So we usually tell you that in advance. Once we have identified that, we'll number however many we're going to test to the different allergens, and we put a cold drop by each number. So each number will test a different allergen. One will be grass, one will be dust mite, one will be dog, etc. They're cold because we keep them in the fridge to keep it stable. Otherwise, if you keep them at room temperature, they go bad too quickly. Then we take a little device that will just prick through the skin. It doesn't cut you, it doesn't make you bleed, it's just a little prick, and then we leave it for 15 minutes. If you're allergic, what we're going to find is a mosquito bite looking area where it's going to whelp up and get red. And the more allergic you are, the bigger that reaction is going to be. And then we'll measure the size of those reactions, and that'll tell us what you're allergic to. Now, occasionally we have someone who's got kind of a borderline test result where it's not really that strong, or we get someone where history suggests that they're really allergic, but then when we test them, we don't really find much. And in that setting, there's a test called an intradermal test. So you've done the prick test, it doesn't show. An intradermal test is a little more invasive. You take a tiny syringe, like a TB syringe, and you lay the needle down flat against the skin and just inject a bleb of the allergen under the skin. And again, then we just watch it for 15 minutes. We don't do those on the back. That would be too uncomfortable. We do those on the back of the arms. And we don't do testing for foods. We only do that for inhalants because it's been shown that intradermals, the injection test, is not safe for foods.
So you may have answered this. During skin testing, what are you looking for to determine that a person has an allergy to something?
Well, two things. Again, on the actual test, we're looking for the wheal and flare, meaning, you get a whelp like a mosquito bite and you get redness around the whelp. And if you get a strong wheal and flare to an allergen, that tells us you're at least sensitized, meaning that you have allergic antibody in your body to that specific protein. The other thing that's key, though, is you have to have the history. So, because it's common for some people to be sensitized but to have no reaction when they're exposed. And we do not consider those people allergic. That's considered a false positive reaction. So you really want to test based on history, because if you don't, then there's a good chance you're going to find falsely positive reactions and you may overtreat somebody. So history and skin test size.
What's the difference between a skin test and a blood test for identifying what people are allergic to?
Well, they both tell us the same thing, and that's trying to identify IgE, or that allergic antibody. The skin test does it by, you've got allergy cells right under your skin. So when you put that drop on the skin and prick through it, if there's IgE to that allergy that you're allergic to, they're going to release chemicals and you're going to get a whelp and flare. The blood test, but there are people that we can't test. Some people can't get off their allergy medications. Some people have real rashy skin on their back and there's just nowhere to really test them. So if we have someone and occasionally, especially in foods, if you have a history of a severe food allergy, then we like to actually start with the blood test, because very rarely, it's very rare, but doing the skin test to a food very rarely can cause the same reaction as eating the food.
Is there a difference in how you test for things like trees, grass, weeds, mold, pet dander, those sorts of things, and how you test for food allergies?
Not really. Again, it just depends on your history. If your history suggests that you're allergic, then we're going to choose, if we can do the skin test and it seems safe, that's what we do. If it looks like for whatever reason we need a blood test, we'll do that. But again, we'll get the same information from either test. And I'll say this too. You get more false negatives from a blood test, meaning it'll read you as negative when you're really allergic. We see that a lot in peanut allergic patients. So the blood test is thought to be about 80% predictive for peanut allergy. But if you've got a kid who shows up negative on the test, but their history is that they eat it and they swell up or can't breathe, then we don't tell them they can eat it, and then we will follow that up with the skin test to confirm it. If you're double negative, negative skin test, negative blood test, then it's very predictive that you're not allergic. But there's still a 1% risk. So if we had someone who had a severe reaction, we would still want to bring that person into the office and challenge them before we let them eat. The nice thing is that to the negative of that, if you've got a negative skin test for an inhalant or a food, it's very predictive that you're not allergic.
How accurate is all of this testing?
It's considered very accurate. Skin testing is thought to be about 90 to 95% sensitive, meaning that if you're allergic, it will show up on the test. Now, there are false positives where people will show up positive but not really be allergic, so that's where your history correlates. The blood test, there's all different ways you can do the blood test. There are a lot of different technologies out there vying for that allergic antibody recognition. The average is thought to be probably 70 to 80%, with some of the newer forms maybe even 80 to 90%. Not quite as good as what you see with skin testing, but pretty close.
Are there risks associated with skin testing for allergies?
Sure, it's a very low risk, but your risk is the risk of an allergic reaction. You're taking protein that you think the patient is allergic to, and you're pricking it onto their skin. Now, with inhalants, we almost never see reactions. I can think of in 16 years, 3 or 4 reactions I've seen where people get more than just the whelp and flare with inhalants. With foods, it's more common, but it's not common.
Okay. Why is allergy testing important?
It's important for a couple reasons. The main reason is that we want to identify what you're allergic to so we can tell you, hey, these are the things you need to avoid or eliminate from your diet or eliminate from your home. Sometimes it's a little bit of a dilemma. So say you live in a house and you've got cats in the house and dogs, and you're having a lot of allergy sinus disease and we're not sure why, and you come in and say, do I need to get rid of my cats and dogs? We may test you and find out it's not cat or dog at all. It may just be dust mite or cockroach. So if you can identify the allergen that someone's reactive to, then you can eliminate it or avoid it. And it teaches it. We have a lot of things we can teach you in terms of what you can do to decrease your risk of exposure. So it helps us on our end too in terms of educating you. The other reason we do it is if you're allergic and we've got you on medication and you're doing the avoidance things and you're not getting better, or you're someone who just hopes to be able to back off asthma, allergy medication, then immunotherapy can be very effective. And we use the information that we find on skin testing or blood testing to tell us what we need to include in our immunotherapy extracts. So immunotherapy would be allergy shots or allergy drops.
We've talked here about testing for allergies, but let me get kind of global with respect to allergies. Mm-hmm. One example, as a kid growing up, all the kids ate peanut butter and jelly sandwiches, and I don't recall ever worrying about anybody being allergic to peanuts. Now it's a big concern in schools. What's changed?
You know, that's a good question. I don't think anyone knows all the answers to that yet, but certainly it's been well documented in the literature that there has been an increase in food allergy, not just to peanuts, in the recent years. I can tell you when I started here 16 years ago, I rarely saw peanut allergy or food allergy at all. It was not a common occurrence, but now I see it many times a week and sometimes daily in my practice. So it does seem to be much more common. In terms of why that might be, the way that a food is processed, whether it's roasted or boiled or cooked, may increase or decrease allergenicity, how allergic you are to it, depending on how it's processed. There's a hypothesis called the Hygiene Hypothesis, and that suggests that if you're around a lot of things that have, let me see if I can explain that better. The Hygiene Hypothesis basically says that if you have a lot of basically non-hygienic exposures early on in life, you live out in the country, you walk around, you're exposed to a lot of outdoor things or bacteria, you go to daycare, you get a lot of viruses at daycare. Before vaccinations came out and everybody got all these different viruses, that actually helps shift your immune system away from an allergic response. So now that kids are vaccinated all the time, and in general, certainly not all the time, we may have a somewhat more sterile lifestyle, and now instead of going outside and really spending a lot of time outside, we spend a lot more time playing on the Xbox or something like that. I think all those are thoughts that we may see more allergy in general, more asthma, more allergy, more food allergy. So that's something that's being worked out, but it's a definite trend that we've noticed in recent years.
Doctor, it's always a pleasure. Thanks for your
Always
time.
my pleasure. Thank you, sir.